It would be a good idea for folks to mute your microphones so that we can avoid a lot of background noise and feedback. That would be very helpful to us. Appreciate you doing that. Get started in a minute or two. Okay, I have 11:31 on my phone, so I'm going to ask Janet to begin the recording of this Let's Talk Zoom session now. Welcome to Let's Talk number 2. My name is George Ferrari, and I serve as CEO of Your Community Foundation. We're so happy that you made time to be with us today. This is the second in a series of 5 deep dives in a quick half an hour to look at sectors within the mission-driven world that have been impacted in particular ways about COVID-19 and racial justice issues, and in terms of figuring out how we can work together to better achieve the goals of our organizations as well as support of the vibrancy of our communities. Today we're joined by Liddy Bargar, who is the coordinator of housing initiatives at the Human Services Coalition. We're very happy, Liddy, that you're here with us. Liddy will present some information about housing. We had a new update as of yesterday, so we're right on top of the latest news. Liddy will present information for about 10, 15 minutes or so. Then we'll have the remainder of our half an hour for conversation and questions. If you have a question now or at any time, you can put that in the chat box, and Amy Levere from the Community Foundation will be managing and facilitating those. Our next session in October, we'll look at dates at the end of our call. Just to remind you, I hope you can join us for that. We'll be around food. We have a session in November around workers and open to scheduling a topic for December. We are likely to look at continuing this into 2021. So with that said, I want to invite and encourage Liddy to begin sharing with us the latest information we know about housing initiatives. And again, thank you for being with us today.
Great, thank you. I'm happy to be here. My name is Liddy Bargar. I'm the coordinator of housing initiatives at Human Services Coalition. Excuse me. In that role, I sort of wear 2 hats. I think the one that I'm going to talk about the most today is going to be about my role as the Continuum of Care coordinator. The Continuum of Care is a HUD initiative that exists in every community across the United States. Here in Tompkins County, ours is called New York 510. We're a single county COC, which is actually fairly unusual. Responsibilities of the COC are many, but the main priorities of continuums of care are to conduct cross-sector and interagency planning conversations around people experiencing homelessness or at risk of homelessness. HUD defines homelessness as a person living in a place not meant for human habitation or in emergency shelter. So that is the primary focus of COCs, are people who fall into that category, or who are imminently at risk of homelessness, meaning 14 days away from losing their primary nighttime residence. Some of the other responsibilities of a COC is to conduct an annual point-in-time count. This happens in the 3rd week of January in every community across the nation. In our community, volunteers and law enforcement go out and attempt to count and survey all people experiencing unsheltered homelessness, as well as people in our emergency shelter. We report those numbers to the federal government. They create a report called the Annual Homelessness Assessment Report, and that determines funding levels for communities. The other sort of primary role of a continuum of care is to manage what's called coordinated entry. So before coordinated entry, the homeless response system was somewhat fragmented, and it meant that the person experiencing homelessness had the responsibility to sort of go around and fill out the applications for possible housing on their own, and were on all these different lists, and people were not communicating about people who had needs. Now that we have coordinated entry, any person who is experiencing homelessness takes what's called a vulnerability assessment. Ours is called the VI SPDAT, if that's of any interest to anyone. the COC, myself and my assistant Taylor, maintain that list. And if and when there are any available openings in any of our permanent supportive housing or transitional housing programs in our community, we send the person on the list who has the highest vulnerability, not necessarily the longest wait time on the list. And the idea of that is to make sure that people who have the greatest level of need are getting served first. You know, it's been quite a process, but it really is working in our community to make sure that people are not slipping through the cracks who are in need of that highest level of support in their housing. As far as what is permanent supportive housing in our community, Tompkins Community Action, what up, Danielle, is our primary provider of permanent supportive housing. They have 4 projects, 4? Magnolia House, which serves men or women with substance use disorder experiencing homelessness, parenting, or with a reunification plan. Chartwell House, which serves men with a substance use disorder. Amici House, which is for young people. Youth are defined by HUD as 18 to 24-year-olds experiencing homelessness. And Corn Street, which is a family site for young people who are parenting and experiencing homelessness, Lakeview Health Services also has 8 HUD beds in their single room occupancy units that are prioritized for people who are chronically homeless with a serious persistent mental illness. And then we have 2 transitional housing programs in our community, the Learning Web, hi Rick and Mona, which also serves that youth population for up to 2 years. We have 3. OAR has a house called Endeavor House. There's 5 men who are re-entering from jail or prison in a transitional manner. And then Catholic Charities has a project that's near and dear to my heart called A Place to Stay, which serves 4 women who are experiencing homelessness in a transitional project. That's sort of like the broad overview of the COC. We host monthly meetings in even months. That meeting is called the Homeless and Housing Task Force. It's a big public meeting. Any of you are welcome to join at any time. We usually have 2 presenters presenting about sort of pertinent things in the homeless and housing world, and then our full COC meetings are on odd months. We just had our first one of the 2021 year yesterday. It was well attended. Some of the work that I have been doing during COVID, one of the sort of most impactful things I've been involved with is starting sort of immediately in March at shutdown. The COC decided to form what we called our Enhanced Street Outreach Team. I see some members of it here, and to make sure that we were meeting the public health needs of people experiencing unsheltered homelessness in Southwest Park, also known as the Jungle. So we have been we were meeting weekly for many months. We actually just switched to monthly to coordinate service needs, including sanitation. So there's some porta potties in that space now. There's some hand washing stations, meal delivery, providing PPE for both people in the encampment and the outreach workers who are serving people in that encampment, and just generally sort of increasing our level of coordination about meeting the needs of people in that space. It has been very successful.
Quick question for you.
Yes.
I have an understanding that with COVID, there was some efforts along with REACH and others to do some telemedicine.
Yep.
Can you talk about the state of telemedicine there?
Sure. REACH is one of our key members of that Enhanced Street Outreach Team. They are doing telehealth outreach in the encampment. I think 6 hours a week, 3 hours, 2 days a week for 3 hours. And it has been very successful. So people are getting to their appointments, they're getting their needs met, they're getting their prescriptions picked up, and are generally better engaged in their physical and mental health. And it has been incredibly impactful for people. And I think going forward, there's some details still being worked out, but REACH will also be doing a mobile COVID testing project where they're going to be doing COVID testing in that space and some other spaces where vulnerable people are, even if they're housed, but some of the people who are living in the single room occupancies and spaces like that, to
Great.
make sure that we have an accurate sense of COVID infection in that community. Yeah, REACH has been a huge part. So the members of that group are REACH, Tompkins County DSS, Family and Children's, that's Tammy and Natalia, OAR, Salvation Army, Loaves and Fishes, Second Wind Cottages are kind of the major players there. Oh, and STEP. And then there are some people who sort of come and go. Yep. Some other things that might be of interest to people is the eviction moratorium and where we are with that. That's the late breaking news, right? So, you know, when I was preparing for this talk 2 days ago, I was preparing to say, in New York State, we have an eviction moratorium that lasts until October 1st. Yesterday, the CDC announced a federal eviction moratorium with some very specific caveats that will be extended through the end of the year. I'm still learning about that. I see some people in this space who might have already learned more than I. I'm looking at you, Keith. But it appears that people cannot be evicted from residential leases for non-payment of rent through the end of the year. I'll let you know if I find out more, or I'm sure we can get some local coverage about what that means for our community. There are some rent assistance programs already up, and there are a few coming as well. So currently, Ithaca Neighborhood Housing Services has a pretty significant amount of funding to be able to help people with 3 months of rent. They can pay back, they can pay forward, it doesn't matter. They can pay back rent or they can pay future rent, is what I mean by that. And that is available to people in several counties, but also specifically in the city of Ithaca. There's an additional pot of money for people who are in the city of Ithaca. We have found that program has been somewhat underutilized, and does have, there's about 130 open spaces in that project. I anticipate that with the end of the additional unemployment, people are going to start accessing that stuff a little bit more. One of the things we did a sort of an informal renter check-in survey a few weeks ago, and what I found is that basically everybody is paying their rent first right now. They're making sure that they're paying their rent. Some of the things that are not getting paid are, you know, I'm echoing.
If you're not speaking, if you could put your phone on mute, that'll help reduce the chance of an echo. Thank you.
People are having, so they're paying their rent first, but there are some other things that they are not paying. Those things include, the biggest things are car-related things, and also debt. So I think we're going to start seeing some of that come to a head for people as well. So even if they're not at risk of eviction, their utilities might get shut off, their car could get repoed. You know, there's sort of like a little cascade lining up for people. And I also, I got, you know, many comments in that survey that said, I'm doing okay now because I have the additional unemployment insurance. I don't know what I'm going to do when that ends. So that. As far as some projects for the future, my agency is launching a landlord engagement project shortly. I think that there has been some loosening in our rental market from what I'm hearing from people who are apartment seeking, and there are certainly people who have vouchers of various sorts and are still unable to locate safe, decent housing that meets their needs. So, you know, I'm looking for some champion landlords who are going to step up and work with people who have vouchers and get supported through my agency in doing that. And then the sort of other big thing in the room is that winter is coming, right? So in New York State, I think it started in 2016, the governor created I don't know, statute that any night that it's below 32 degrees, including wind chills, all persons experiencing homelessness are required to be offered shelter without conditions. So our community has risen to that challenge and has done a really great job sheltering people for the winter. We haven't actually heard if that is going to continue this year. My belief is that it will, but because of public health measures related to COVID, the spaces and the sort of informal spaces in which people gather during the day to get warm are all closed. The Friendship Center is open at very limited capacity and is not a space where people can sort of just hang out and get warm. You can come in, you can get your shower, you can get your mail, but you can't hang out. So there's a lot of community conversations happening around that issue about how are we going to make some spaces that are safe for people during the day to be able to come inside and warm up. There's also been some conversations about the lack of public restrooms, so we're going to start trying to work on that in our community as well to make sure that we don't have a secondary public health crisis due to the lack of public facilities.
Great. Thank you, Liddy. That's a lot of information. Thank God you're staying on top of that, along with many other people on this call. I see people who are doing a lot of housing advocacy and housing services. I wanted to see whether we might have some questions for you to respond to. I know that Amy's been tracking them in the chat box. Again, if you have questions, you can go ahead and type them in there and we'll get to as many as we possibly can. Amy,
we have a lot of questions. Liddy, could you please talk about the issue of building new handicap accessible housing, so incorporating that universal design, because perhaps there's many residents who are in nursing homes that could live independently if they could find supportive housing?
I am not a qualified person to respond to that, to be honest. I hear you in that question, but that is not so much in my wheelhouse that I feel confident speaking to it at this time. I'd be happy to get back to people with some information though.
That sounds great.
I think in the current set of conditions, we're focusing on homeless and eviction prevention kind of stuff, and then the broader questions about housing continue to exist, but there's sort of a triage kind of thing. And as many people think things will get worse as we move through the winter, that there might be a bit of a lull here right now, but we'll do some research and get back to folks about that. The second question?
And then going along in that more pressing direction, when people move into those short-term or temporary housing environments that you had mentioned, about how long do people stay in that? And then is there a hierarchy of determining space for who has priority? So for example, pregnant women or families, or how does that mechanism work?
Okay, so that's two questions. The first question is, how long do people stay? So permanent supportive housing is permanent. They can stay as long as they want. Transitional housing, the Learning Web is a 2-year program, and the other two, I think, are designed to be more in that sort of like 3 to 6 months range, although certainly people stay. Those programs are not discharging people to homelessness. So people are welcome to stay until they are able to find another appropriate housing. As far as determining hierarchy, the agencies seeking funding, so the COC is also a funder, but the agencies seeking funding are determining that priority. The COC has some priority populations. Our priorities are people experiencing chronic homelessness, which has a very specific definition. And we also have some youth and reentry priorities in our COC, but agencies, as they apply for state or federal funding, they're setting the priorities.
I see a couple of questions around access to some of the existing programs, right? The programs are probably inadequate to the need as the need increases. Sometimes they're encumbered by federal or state or other restrictions, and you know, things like, is the INHS program just for INHS tenants? And,
Yeah.
and how, so there maybe, Amy, are a couple of questions in that kind of bundle that we can look at.
I can see them. I see the questions.
Super. So if you take that rent question, that would be just terrific.
The INHS one?
Yes.
So no, in fact, the INHS tenants were at a lower priority when the program opened than members of the general public. I would be happy to send George some information about this project. They have done a ton of marketing. It's out there. It opened on June 15th. It is available to people who are under 80% AMI and have a verifiable COVID effect to their income. So those are the two sort of caveats to that program, but it is widely available in the city and the county to anybody, any renter who needs it. I see a gaps question. I could talk about that all day long.
That's exactly the right place to go.
We have a number of gaps in our community. You know, not for lack of trying. We have some amazing agencies doing all that they can with the space and the funding that they have. Some of those gaps include what I would describe as single room occupancy housing for single people to be able to have their own space, a door that locks, a unit that is their own, but is also manageable and affordable for people without a special population designation. So just like, you know, regular homeless. There's also some gaps, and we're working to fill some gaps around the reentry piece, people who are reentering from jail and prison. I would love to see more projects for women. There's plenty of gaps. We also don't have, you know, other communities have some halfway house style housing in their communities. We don't have anything of that sort in our community. That wouldn't necessarily fall into a continuum of care project, but it would certainly be useful, I think, for people who are coming home from inpatient treatment to have a safe place to stay. Yeah, those are the big gaps. There's plenty of gaps. We have some additional funding coming in the next month or so that is going to fund a fairly significant number of additional rapid rehousing vouchers. So rapid rehousing is a scattered site model. People are finding their own units, but are supported by case management. I think that will be helpful, but I think we have a need for additional agency-owned housing spaces to better support people.
And then are there ways that you are working with faith communities to address the issues of warming stations or other types of needs?
Yes. So last year, all people who came into shelter under cold weather policy were sheltered in churches, primarily the Salvation Army Church, but also there's a couple others, Danby, and one other that I can't ever remember when it counts. And we are having that conversation around the cold weather spaces as well with our faith partners, certainly.
And can you talk about how people can use the 211 to address housing-related services?
Call 211. They'll get you connected. 211, you know, exists in my agency. They have excellent, up-to-date, compassionate information for people and are excellent at helping people find what they need. I see a question in the chat about other help for back rent beyond the INHS program. So that same funding that I just talked about, the ESG funding, has a prevention component. There will be some help coming online with that program for people who don't have to have that verifiable COVID effect. There's also several agencies who got some funding through FEMA Emergency Food and Shelter Program for back rent. I think that they're still working to get those programs online. But 211 actually has a really great list of all of our back rent resources right now. And feel free to call. Yeah.
And then can you also talk about how people can, or how about the differentiation between space that requires no drug or alcohol use, and maybe those that have, issues of getting housing?
So the COC has a housing first perspective. Housing first means that if somebody's going to be funded with COC dollars, they need to agree that there's no preconditions for their housing, so including things like sobriety. So once they're in housing, housing providers can offer to support people with substance use disorder or other mental health or whatever, but the COC does not fund agencies that don't adopt that housing first perspective. It is my belief that it's kind of a trap to ask somebody to get clean so they can get in housing. If they don't have housing, I don't know how they're going to get clean, or get into recovery, however you want to use that language. We don't fund anybody who doesn't have a housing first perspective. It is difficult. It is a difficult population. It can be hard to keep people in housing who are in active substance use, but we're committed to housing all persons, regardless of their disabilities.
And Liddy, you had mentioned just before we began the formal part of this call that even though there is a eviction moratorium that has to do for lack of payment, that there are other ways that people might be vulnerable to becoming homeless. And can you just explain what that might be?
Sure. I mean, so there's some loopholes or whatever you want to call them. One of them, the one that I predict we will see the most is that what's considered a holdover eviction will become more common. So instead of just doing a non-payment eviction, they'll wait until a tenant's lease has expired, not offer them a new lease, and then evict them on that holdover style of eviction. Also, lease violations are still do not fall under the category of non-payment of rent, so that those are like behavioral things, and those people can still be evicted for. And I strongly encourage any tenant who is being evicted for a behavioral reason, or really any reason, to contact Law New York and make sure that they have representation, because it can be very intimidating to go into a courtroom without representation. There's a lot of sort of really detailed stuff around eviction, and there is also the landlord will have a lawyer, I promise. So it's really only fair that the tenant does as well, to make sure that their rights are not being taken advantage of. And I think something like a behavioral violation is a very like he said situation. So having an attorney can help with that.
Yeah. We're coming up on the end of our time together, and Amy might have one or two last elements. Go ahead, Amy.
If we could squeeze in one more, that'd be great.
Go for it.
Can you talk just a little bit about the wide variety of organizations that make up the COC, and how many members are there? Where did they come from?
Sure. We have what we consider 39 member organizations. I probably can't name them all, but I can get through some of them. So we have representation from both city and county government, including electeds and administration. We have representation from Tompkins County DSS, Salvation Army, Catholic Charities, Tompkins Community Action, OAR, Law New York, staff, Child Development Council, basically all the persons serving agencies.
Yeah, you do an amazing job of staying connected and networked with each other and doing it in a collaborative fashion. Just imagine if we didn't have that infrastructure and that backbone, how discoordinated things would be. So, yeah.
I've been in my role for about a year and a half in this position, and I have certainly seen a high level of commitment from our partner agencies. People are working together, people are on committees working on special projects, people are doing data entry. I mean, all the things we want them to do. So it's a good, we have a strong COC.
So I want to thank everyone for taking time to be with us to sort of just get a little bit of a taste of all the housing issues. These things are ongoing. And I want to thank Liddy for taking time out of your important and busy work day to be with us today as well. We're going to continue this series with the next session will be in early October, and that we will be joined by Holly Payne, Tompkins County COVID-19 Food Task Force. That's October 7th to talk about food and what's going on in that sector. And these things are all connected, right? Our first session was on K through 12 schools. We have a video archived here. We'll have this video archived on this site later on this week, and want to encourage folks to stay connected with us. And as you have more questions and seek more information, look to the folks who are presenting, as well as your community foundation as a source of information for these needs as you're planning your charitable giving. So thank you so much for being with us. We're going to continue this conversation throughout the rest of the year, I'm sure, and well into 2021. Thank you all for all the work that you do in our community.
Thank you. Have a good day.